Hello guys, welcome again to my number one HSC Leslie Bones YouTube channel. So as you all know that everyone should have some basic knowledge about when and how to administer first aid. In this video, I'm going to show you some guides that can help you find many appropriate treatment quickly when you're doing first aid. First aid topics: establishing ACBC, CPR for an adult, CPR for a child, CPR for an infant. Also, we're going to check at the recovery position. Establishing ACBC. Observe the casualty as your approach to find out if he is conscious or unconscious. Ask the casualty question. If there is no initial response, gently shake the casualty shoulder. If there is still no response, he is unconscious. A, which stands for airways. The first step is to check that a casualty's airway is open and clear. If, however, a casualty is unconscious, the airway may be obstructed. Tilt the head and lift the chin to open the airway. C, which is spine. If you suspect a spinal injury, open the casualty air using the jaw thrust technique. Place your fingertips at the angle of the casualty jaw. Gently lift the jaw to open the airway. Take care not to tilt the casualty's neck. B, which stands for breathing. Is the casualty breathing normally? Look, listen, and feel for breath. If the casualty is still not breathing, begin CPR. If he is alert, he will be breathing. However, it is important to note the rate, depth, and ease with which he is breathing. Treat any difficulty found before going to the next stage. Let's look at C, circulation. Are there any signs of severe bleeding? Control any bleeding and treat the casualty to minimize the risk of shock. If life-threatening conditions are managed or there are none present, beginning to the check for other injury or illness. CPR for an adult. Number 1, check that the airway is open. Move to the casualty's head. Tilt the head with one hand, with 2 fingers of your other hand to ensure the airway is open. Number 2, begin rescue breath. Pinch the casual's nose firmly to close the nostril and allow the mouth to fall open. Take a breath and seal your lips over the casual's mouth. Blow steadily into the mouth until the chest rises. This should take about 1 second. Give 2 rescue breaths. Number 3, position hands on chest. Place one hand on the center of the casual's chest. Place the heel of your other hand on top of the first and interlock your fingers, but keep your fingers off the casual's ribs. Give 30 chest compression. Lean directly over the casual's chest and press down vertically, about 4 to 5 centimeters. Release the pressure but do not remove your hands. Give 30 compression at a rate of 100 per minute. Number 5, watch chest fall, maintaining head tilt and chin lift. Take your mouth away from casualty. Look along the chest and watch it fall. Repeat to give 2 rescue breaths. Repeat 30 chest compression, followed by 2 rescue breaths. Number 6, continue CPR until emergency help arrives. The casualties start to breathe normally or you are too exhausted to continue. CPR for a child. First, check that the airway is open. Move to the child's head. Tilt the head with one hand. With 2 other fingers of your other hand to ensure the airway is open. Number 2, begin rescue breath. Pinch the child's nose firmly to close the nostril and allow the mouth to fall open. Take a breath and seal your lips over the child's mouth. Blow steadily into the mouth until the chest rises. This should take about 1 second. Give 2 rescue breaths. Number 3, move to the child's chest. Place the heel one hand on the center of the child's chest, but keep your fingers off the ribs. Number 4, give 30 chest compression. Lean directly over the chest and press down vertically about 1/3 of its depth Release the pressure, but do not remove your hands. Give 30 compressions at a rate of 100 per minute. Number 5. Give 2 rescue breaths. Return to the head and give 2 rescue breaths. Repeat 30 chest compression, followed by 2 rescue breaths for 2 minutes. Number 6. Continue CPR until emergency help arrive. The casualty starts to breathe normally, or you are too exhausted to continue. CPR for an infant. Number 1. Place the infant on his back on a flat surface at about waist height in front of you or on the floor. Make sure the airway is open by keeping one hand on the infant's forehead and one fingertip of the other hand under the tip of his chin. Number 2. Pick out any visible obstruction from the mouth and nose. Take a breath and seal your lips over the infant's nose and mouth. Blow steadily into the mouth until the chest rises. This takes about 1 second. Number 4. Maintaining the head tilt and chin lift, take your mouth off the infant's mouth and see if his chest falls. If the chest rises visibly as you blow and fall fully when you lift your mouth, you have given a breath. Give 2 rescue breaths. Number 5. Place 2 fingertips of your lower hands on the center of the infant chest. Press down vertically on the chest by 1/3 of each depth. Release pressure without losing contact between your finger and the breastbone. Allow the chest to come back up fully before giving the next compression. Give 30 chest compression at a rate of 100 times per minute. Number 6. Return to the infant's head and give 2 further rescue breaths. Number 7. Continue alternating 30 chest compression with 2 rescue breaths for 2 minutes, then stop to call for emergency help. Continue CPR until emergency help arrives. the casualty to breathe normally, or you are too exhausted to continue. The recovery position. 1. Kneel beside the casualty. Remove any glasses or bulky objects from his pocket. Number 2. Make sure the casualty's legs are straight. Place the arms that is nearest you at right angled to the casualty's body, with the elbow bent and the palm facing upward, like you can see in the picture. Number 3. Bring the arm that is farthest away from you across the casualty's chest and hold the back of his hand against the chest nearest you. With your other hand, grasp the far leg just above the knee and pull it up, keeping the foot flat on the ground. Number 4, keeping the casualty hand pressed against his cheek. Pull the far leg and roll the casualty toward you and onto his side. Number 5. Adjust the upper legs so that both the hip and the knee are bent at right angles. Number 6. Tilt the casualty's head back. Tilt his chin so that the airway remains open. Number 7. If necessary, adjust the hand under the cheek to keep the airway open. Number 8. Call emergency number if it has not already been done. Thank you guys for watching. Please don't forget to subscribe if you're new here to my channel. Don't forget to like, share. See you in the next video.